When it comes to healthcare in the United States, few topics spark more debate than immigration. Can undocumented immigrants get free medical care? Can hospitals refuse to treat them if they can't pay? The truth might surprise you. Since 1986, federal law has been crystal clear. The Emergency Medical Treatment and Labor Act, better known as EMTALA, requires hospitals with emergency departments that accept Medicare funds to treat anyone who comes through their doors with a medical emergency. No exceptions. That includes undocumented immigrants. And payment, or lack of it, can't stand in the way. Under EMTALA, hospitals must first provide a screening exam to see if an emergency condition exists. If it does, they're legally obligated to stabilize the patient or safely transfer them to a facility that can. But here's the catch. EMTALA only covers emergency care. It doesn't guarantee ongoing treatment for chronic conditions, follow-up visits, or preventive care. And hospitals still send the bill even to undocumented immigrants. Let's break it down. Emergency care? Yes, hospitals must treat everyone. And non-emergency care? Not required, and it can be denied. Emergency Medicaid? Sometimes available for low-income patients, but it only covers emergencies, not long-term treatment. So what happens when patients can't pay? Hospitals try a mix of strategies. They tap into emergency Medicaid if the patient qualifies. They seek limited federal reimbursements under programs like Section 1011. They ask states and cities for extra funds. And when none of that covers the cost, they absorb the loss as what's called uncompensated care. This uncompensated care adds up. Denver Health, for example, reported spending $136 million on unpaid care in a single year, much of it tied to undocumented immigrants. The hospital had to cut services, delay raises, and put renovations on hold. But here's an important fact. No U.S. hospital has ever gone bankrupt solely because of care for undocumented immigrants. Yes, the strain is real, especially for safety net hospitals, but financial challenges usually come from many sources, like low Medicaid reimbursements, rising labor costs, or poor management. So who pays when the bills go unpaid? The costs ripple across the system. Insured patients face higher charges. Taxpayers sometimes foot the bill through state or local funding. And hospitals themselves absorb much of the loss. Let's clear up some common myths. Do undocumented immigrants get free healthcare? No, hospitals bill them, but many can't pay. Can hospitals refuse treatment? No, federal law forbids it in emergencies. Do immigrants cause hospitals to go bankrupt? No, uncompensated care is costly but not the sole cause of closures. Does Medicaid cover undocumented immigrants? Only in emergencies and only if they meet strict income rules. At the end of the day, EMTALA ensures no one is left to die in an emergency room because of their immigration status or their wallet. But it doesn't erase the financial challenges hospitals face or the bigger debate about how we handle healthcare and immigration in America. Emergency care is a guarantee. Payment, coverage, and fairness? That's where the real debate lies. And as costs rise, this issue isn't going away anytime soon.